Hello and welcome to Texas A&M University Emergency Care Team series of skill videos. In this video, we'll be taking a look at oxygen administration therapy. Please take a moment to familiarize yourself with the required equipment, including the oxygen tank, personal protective equipment, regulator, and the appropriate administration method apparatus. Before you begin, always make sure the scene is safe and that you have your personal protective equipment on. Always take appropriate oxygen tank precautions. When it's standing upright, make sure you have a hand on it at all times, or lay it down on the ground or another flat surface. To begin, assemble the regulator onto the tank. The two prongs on the inside of the regulator should match exactly to the holes on the oxygen tank head. Insert the two prongs and tighten the screw. Next, using the wrench, verify the flow and the pressure of the tank. You should hear a small hiss, and you should see the arrow jump. Note that for a regular oxygen tank, the normal oxygen levels are between 500 psi and 2000 psi. Lay the oxygen tank back down on its side and select the appropriate administration apparatus. First, we will take a look at the nasal cannula method, which is used to administer low-flow oxygen. Attach the tubing to the regulator and select the appropriate flow rate, which for a nasal cannula is from 1 liter per minute to 6 liters per minute. Apply the nasal cannula to the patient with the prongs facing down and wrapping the tubing around the ears and tightening around the neck. To remove, follow the directions in reverse. Next, we will take a look at the nebulizer, which is commonly used to administer medications such as DuoNeb. To begin, assemble the nebulizer, taking note that parts can only fit one way. Attach the tubing to the regulator and the nebulizer, and select the appropriate flow rate. For the nebulizer, the appropriate flow rate is from 6 to 10 liters per minute. Make sure you see a mist flowing from two ends of the nebulizer. Administer the device to the patient, making sure that you are not blocking the other end of the nebulizer. Remove from the patient and detach the tubing. Finally, we will take a look at the last oxygen administration method, which is via non-rebreather mask. This method is used to apply high-flow oxygen to a conscious patient. Begin by attaching the tubing to the regulator and setting the appropriate flow rate, which for a non-rebreather is 10 to 15 liters per minute. Make sure you pre-fill the bag so that the patient has some volume to breathe with. Next, apply the mask to the patient by fastening the straps around the head and tightening the two metal prongs around the nose. To remove, pull the mask away from the face and pull up. Make sure not to slap the patient with the straps. To disassemble the device, make sure the switch is closed and use the wrench to close the valve. The regulator will have some air left over, so make sure to let the excess air out. Next, you can remove the regulator by unscrewing the screw and removing the two prongs from the holes. Make sure to always lay the tank down flat.